Back on this Saturday morning, Sports Medicine Weekly. And net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. Our producer is Shane Reardon. Our coordinating producer is Tracy Taro. I'm Steve Kashul with Dr. Brian Cole. And time now for our Ask the Doctor segment. It's very easy for you to get involved in our show. Go to our website, sportsmedicineweekly.com, and on the home page, you can click underneath the picture of yours truly and Dr. Cole, and that's our Ask the Doctor link, and you can ask the doc a question. Got a good one here that's right up your alley. Brian Cole, you ready?
I am.
My friend tore his ACL, Dr. Cole, and his doctor was discussing ACL Repair versus ACL Reconstruction. Are these procedures the same? If not, what is the difference?
So an ACL repair is something that was saw the light of day probably 25, 30 years ago and was tried and failed. And perhaps it had something to do with the nature of the technique. Of recent, there has been an interest or resurging interest in repairing a torn ACL rather than completely reconstructing it. So when we reconstruct it, we actually will take a source of collagen to provide a graft, something that will replace the torn ACL. So the middle third of the patella tendon, the hamstring tendons, donor tendons, allografts, things like that can be used, right?
Right.
And so that's the typical ACL reconstruction where we ignore the tissue that's remaining and just simply bypass it and replace it with collagen.
What was the old repair, by the way?
Well, we would just take literally pass some sutures in the torn ACL and then
Like sew it up.
Yeah, and sew it to the bone and through a drill hole. And it didn't work very effectively. So why now? Well, there's been some new technologies available that allow us to do technically a better job, and we are starting to self-select tears that might be more amenable to repair rather than reconstruction under the auspices that a repaired ACL can get an athlete back in 3 months rather than a reconstructed ACL at 6 months. Now, I'm not a naysayer, but I'm one that currently is not a huge believer that this plays a primary role in the management of the ACL torn patient. We do so incredibly well in patients who tear their ACL with reconstructions that at some point, if you have to stack a failed repair against a new reconstruction, you're looking at potentially doubling the amount of time the athlete is out. That being said, there probably are scenarios where a partial tear, for example, or a specific type of tear where the ligament tears directly off the bone might be amenable to repair. So I would argue that if a patient is out there and is looking to shorten their recovery time to get them back to sport and they're contemplating repair, that you want to go to someone who understands both sides of the decision-making and who isn't necessarily doing one or the other so they can share their experience, because it is a very hot, controversial area. And to date, not a lot of people are willing to try this out on a high-level elite athlete. But, you know, things over time, when you get comfortable in lower demand patients, it may get to that point. We are now, for example, doing primary repairs of the ulnar collateral ligament of the elbow, the Tommy John problem. Same thing. We typically reconstruct them with a graft, but now there is a movement in some high-level elite players to actually repair it to shorten the duration of recovery time rather than reconstruct it. So I think we need to keep looking in this area. The jury's not out, but it clearly is a very important topic to be discussing.
I got a minute and a half left in the show. Here's our last question for our Ask the Doctor. I am bow-legged and have osteoarthritis. My doctor gave me something called an unloader brace. What exactly does this do?
Yeah, so when someone is bow-legged, they transfer their forces to the inner side of their knees. So you look at them, they're literally like riding a horse. You know, Steve, you're kind of bow-legged where the knees go to the outside. And a unloader brace is a mechanical way to basically offload the inner side of the knee by forcing the tibia to the outside. So it's a brace called a three-point bending brace, which will help to offload the inner side of the knee so that even if an individual has arthritis, when you offload it, they have less perception of the arthritic change. So, for example, for a while we had Joakim Noah, who we placed in an offloader brace, who had the opposite issue where he was malaligned with the knees closer together, sort of knock-kneed, if you will. And that helps to offload the outer side of the knee. So we'll occasionally use them in high-level athletes or just people who want to remain active as a alternative to surgery.
All right, great stuff. We're out of time for this edition of Sports Medicine Weekly. Many thanks to our producer. He is Shane Reardon. Our coordinating producer is Tracy Tarr. Also want to thank David Cole for managing our website. That is sportsmedicineweekly.com. And also to our business manager, Samantha Smith. Does a wonderful job for Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul saying so long. Thanks for listening to our show, Sports Medicine Weekly. Up next on The Score, Early Odds with Joe Ostrowski. We'll be back with you for a brand new edition of Sports Medicine Weekly next Saturday at 8 a.m. only on
670, The Score.